Hi, Dr. Fulco. Thank you for taking time to come and talk with us today. Why is it so important to give learners feedback?
Well, to me, feedback is really at the heart of everything we do as medical educators here at VCU to promote learning. It's absolutely crucial to the development of competent physicians. In this era of milestone-based competencies, we now have a good framework to provide our feedback to our learners so that we can ensure that certain competencies are being met. So by providing good, honest feedback to our learners, now we have an opportunity to give them an accurate assessment of where they stand. You can imagine a learner who hasn't gotten any feedback. If they haven't gotten any feedback, they may assume that, oh, they must be working fine, their work must be great, because, hey, I never got any bad information back, I never got any bad advice. This way it gives them an accurate perception of exactly where they stand, and it also allows them to self-reflect on their performance. By this deliberate and conscious effort of reflecting on their processes, by reflecting on their performances, it gives them an opportunity for self-improvement.
What are some recommended do's and don'ts when it comes to giving feedback to students or trainees?
Well, that's a good question. Jack Endy is a former VCU School of Medicine graduate, by the way, who wrote one of the seminal articles in giving effective feedback in clinical medical education. And some of the guidelines that he recommended doing is, first and foremost, is that the teacher and the learner should be allies with common goals in a learning situation during an observation period. So making sure you're aligned with your students, meeting with them early to set up expectations ahead of time and set up what their learning goals are is really crucial and important. Being specific as you possibly can, and avoiding generalizations is another important aspect of providing good feedback to learners. We've all been in that situation where we've said, hey, you did a great job, but without knowing specifically what they did a good job on or what the areas of improvement can be focused on, the learners are never going to grow. Another thing that Jack Endy spoke about is actually having the information being based on first-hand data and regulate the quantity, and actually using descriptive language and non-evaluative, non-judgmental language are certainly important aspects of providing good feedback.
What strategies have you found are most effective in getting learners to hear the feedback you're giving to them?
There's this concept called feedback disconnect. Our learners will say, yes, absolutely, I want feedback. Our faculty members say, I give feedback all the time, where our learners are going to say, listen, I never got enough feedback during this rotation. So there is a disconnect. One of the things that I've found that helps me be successful at it is really by labeling the feedback. If you tell your learners, listen, I'm going to give you feedback, set up times, have them expect it, I think it becomes more effective to actually hear you. Tell the learner, I just gave you feedback, what do you think? Is another way for them to actually hear that feedback is actually happening. And using this ask, tell, ask method that's been supported by some groups, which say you ask the learner how do they think their performance was. You tell them whether you agree with that or whether you think that there are areas that they weren't as insightful on. And then you ask them again whether they understood the feedback that they just received.
What about feedback from learners? Should faculty seek that out, and if so, why?
I would say absolutely. It helps the learners realize that feedback is all about professional growth and personal growth. So by me as a faculty member asking my learners, how do you feel like I did? How was my teaching during this session? It lets the learner, puts them in a position to realize that, hey, feedback is really all about professional and personal growth. I oftentimes will want to know, how did my teaching session go? You have to, though, keep in mind that there is a particular psychological size that it may be difficult for your learners to give you honest feedback, especially in a face-to-face setting. In those situations, I'll always tell my learners, I still want your feedback. Your written evaluations and your written feedback is totally anonymous, so make sure you complete your evaluations for me, at least in that aspect, so that I can grow myself.
How often and under what circumstances should feedback be given?
Well, I like to think of feedback as the multiple small feedings of the mind. So rather than the buffet of feedback, giving them too much corrective feedback that might overwhelm your learners, most experts would agree that giving only 2 to 3 corrective items to focus on at a time is probably the most beneficial. And also focusing on giving that feedback as closely to the observation period as you possibly can is also the most effective way of giving good feedback.
In your opinion, what is the most challenging aspect of giving feedback?
oftentimes faculty members just don't feel like they have a lot of good time to provide good and honest feedback to our learners. And not only that, but also it's difficult sometimes to directly observe our learners in action, working directly with patients so that we can provide good and honest feedback to our learners. So that finding the time is certainly can be a challenge, but I will make the argument that in 1 to 2 minutes you can provide really good feedback. Even if it is minimal in quantity, you can really provide good feedback in a short period of time.
Is there any other advice you would offer to faculty about giving or receiving feedback?
So it's a skill that can definitely be nurtured and improved upon. And remember, it's going to be most effective when you enter in a relationship with your learner that is collaborative and that is collegial, and that you're interacting with them, understanding their learning goals, but also having them understand what objectives you have out of a particular observation period.